When it comes to the stats, 5 Arizonans every day are passing away from an opioid overdose.
Opioid addiction can happen incredibly quickly, and it can happen to anyone. So many of us have been impacted by this horrible epidemic that we're seeing here in Arizona and across the country.
Pretty much everybody knows someone with a substance use disorder, whether we know it or not. Naloxone, which is also known by the trade name Narcan, is an opioid antagonist. So it has the opposite effects of an opioid. Opioid overdoses do not need to be fatal. I believe that fatal overdose is 100% preventable if people have naloxone around them. People can only get into treatment and recovery if they're alive.
Recovery is possible, but it's not possible if I'm dead. Narcan will definitely help buy some time to gain a desire to get into recovery. When I overdosed, I was Narcan. I am living proof. It bought me enough time to get the desire to want to change and to want to help others.
I'm just an average kid from the South Shore of Massachusetts that had a couple hopes and dreams and got hooked on painkillers. I can still vividly recall my mom in her hopelessness. We would go to the doctors with a bag full of prescriptions, and she'd say, "This needs to stop. This needs to stop." September 2nd of 2017, my nephew found me overdosing in my room. The only reason I am breathing here today is because of Narcan and Naloxone.
This touches everybody. The commonality you'll hear 9 times out of 10 is, "I wish I had this when." Wishes are now turning into reality.
It used to be that naloxone was very hard to access. It was sort of in the ivory tower of the hospital and hard to get. It was kept in the operating rooms initially, then it moved into the emergency departments and the ambulances. But it wasn't in the hands of people who needed it most.
There was a huge measure that went through by the FDA, so naloxone is over the counter. You can purchase it at your local Walgreens, Walmart, anywhere that is an active drugstore.
I carry naloxone. I have some in my purse right now. I think everybody should, because you never know when you're going to come across an overdose. People who have no medical training can easily follow those instructions and give it. And it's just a little spritz in the nose.
I'd rather have it and not need it than need it and not have it. You want it in your medicine cabinet because there might just be a kid in your household who accidentally ingests a painkiller that you have in your cabinet from 3 years ago. I don't ever expect there to be a fire in my house, but I have a fire extinguisher.
I hope that it is included in every first aid kit, just like a Band-Aid is.
Having naloxone available can absolutely save lives, and we know it's saved hundreds and thousands of lives across Arizona.
But it's that complete stranger that takes that Narcan, keeps it in their truck or keeps it in their car, and then they see someone in a moment and they actually can step in and save someone's life.
I think what's most convincing is talking to someone who's been through it and hearing their story. Talking to people who have had overdoses reversed, who have gone into treatment and are now thriving. And they wouldn't have had that opportunity if no one had rescued them with naloxone.
Can't believe that I'm alive sometimes. And honestly, I'm just giving back. I'm doing for others what was done for me. And you can be in recovery as well. It might be painful in the beginning. I'm not saying it's gonna be easy. I'm telling you it's gonna be worth it.
I see life like I've never seen it before. I see compassion for whomever I come across, because I know my purpose in life today is to be a service to others.
When it comes to naloxone, be kind with every story you hear. Be the change you want to see in the world.